Welcome to this video on the clinical applications of the dobutamine stress test, a chemically induced form of cardiac stress testing that plays a vital role in assessing cardiovascular function, especially in patients who are unable to undergo traditional exercise stress testing. In this video, we'll cover the primary applications of this important diagnostic tool. First, let's discuss the diagnosis of coronary artery disease, or CAD. The dobutamine stress test is widely used to detect myocardial ischemia, which occurs when areas of the heart do not receive adequate blood flow during stress. This is indicative of significant coronary artery blockages, and the test helps identify patients who may benefit from further interventions, such as angioplasty or coronary artery bypass surgery. Next is the assessment of myocardial viability, particularly after a myocardial infarction or heart attack. The test can help determine which regions of the heart muscle remain functional under stress, guiding decisions on whether revascularization procedures could restore function to ischemic but still viable heart tissue. The test is also crucial for preoperative cardiac risk stratification. For patients undergoing major non-cardiac surgery, especially those with known or suspected CAD who cannot perform an exercise stress test, the dobutamine stress test evaluates the risk of cardiac complications. This helps in planning and managing perioperative care. When it comes to assessing heart failure, the test is valuable in differentiating between ischemic and non-ischemic causes. It also evaluates the heart's functional capacity and reserves, providing critical information for managing heart failure patients. The dobutamine stress test is also used to evaluate valvular heart disease, particularly stress-induced valve dysfunction. This is important for understanding how conditions like aortic stenosis or mitral regurgitation affect valve performance under stress, guiding decisions on surgical interventions or other treatments. Another key application is the assessment of left ventricular function. The test measures the ejection fraction, which is how well the left ventricle pumps blood under stress. This is especially useful in patients with borderline or reduced ejection fraction at rest, as it can reveal additional impairment or reserve capacity that might not be apparent in resting measurements. For patients with known CAD, the dobutamine stress test can be used to monitor disease progression. By assessing the heart's response to stress over time, the test helps in adjusting treatment plans and ensuring that the disease is being managed effectively. In cases where patients experience unexplained shortness of breath or fatigue but are unable to exercise, the dobutamine stress test helps determine if these symptoms are related to heart disease. It can reveal cardiac abnormalities that might be missed during resting evaluations. The test is also used to evaluate stress-induced arrhythmias. It helps in detecting the presence and severity of arrhythmias that may occur during physical stress, particularly in patients who have experienced palpitations, syncope, or other symptoms suggestive of arrhythmias. Finally, the dobutamine stress test plays a role in research and clinical trials. It is often used to evaluate the efficacy of new cardiac therapies, drugs, or interventions, providing a controlled environment to assess how new treatments affect heart function under stress. In summary, the dobutamine stress test is a versatile diagnostic tool with applications ranging from the diagnosis of coronary artery disease to the evaluation of heart valve function and heart failure. It is particularly valuable for patients who cannot undergo traditional exercise stress testing, providing critical information for the diagnosis, management, and monitoring of various cardiovascular conditions. Thank you for watching. If you believe the dobutamine stress test might be right for you, or if you have concerns about your heart health, be sure to consult your healthcare provider.